Welcome to the one more session of our YouTube live. This time we had to postpone our Saturday YouTube onto Monday because I had some prior engagement. That's why I could not take on Saturday. So let us start once again our YouTube live, a question answer session. So we are live on Instagram and YouTube both. So welcome Dr. Komal, Dr. Kuta Homeopathy Clinic. So again, let us first of all discuss. Last time there were a few cases where one doctor had asked something about a case of, I think there was a trauma and there was hematoma in the brain and the patient was admitted in the ICU and we had prescribed the remedy. And after that remedy, if when she comes online, we'll discuss actually what happened to that patient. And the results are very good because I had spoken to the doctor and the patient improved very well and the patient is out of the ICU, is much better. So whenever the doctor is online, we'll basically ask the doctor who has treated that patient. As you go further, there is basically a very important symptom, a very important remedy which I prescribed to a patient. It had a very, very interesting symptom, a very, very interesting, as I always say that in mathematics, if your interpretation of that symptom is nice, to the point, automatically the remedy comes out. The patient came with a very important symptom that she was a very anxious personality. There was a lot of anxiety in that patient. And the patient says that after the anxiety part is over, when she's so anxious, she starts weeping. And this was a symptom of the patient right from Sora to psychosis to syphilis. Every time she had anxiety, it was followed by a lot of weeping. So this is a very, very important symptom you understand. There are remedies like Kali iode, graphitis, in fact phosphorus also, where it is written that when there is a lot of weeping after anxiety. Welcome Dr. Simra. So whenever there is a lot of weeping after anxiety, remember that it is very important to know that after anxiety, how does the patient react and responds. Some patient has a lot of palpitation, some patient has a lot of perspiration, some patients suffer from butterflies in the stomach, some patients have diarrhea, some dysentery. But whenever the patient says that the patient has a lot of weeping after anxiety, there are 3-4 remedies which I have used in my practice and which has given me very, very good results. Those are Kali iode, graphitis, phosphorus, and one is carcinosin also. It is such an important symptom, and if it runs to the whole patient's constitution or if it defines the patient's personality, you have to take that symptom for prescription. Okay, welcome Dr. Sharon, Dr. Saif Zishan Ali, so Dr. Rajkumar Mujahid, Dr. Meera. So this is a symptom where there is basically weeping after anxiety. Now, if you open your mathematics, I have told you something good about phosphorus. Lot of symptoms about phosphorus, and phosphorus covers wide range of symptoms. But this symptom of weeping after anxiety, make sure that you take this for prescription. If you see phosphorus, there is one more symptom of phosphorus. The patient is very restless. The patient is very fidgety. So much so that the patient moves constantly. The patient cannot stand still for a moment. Whenever this symptom comes, of course, we always think about zincum metallicum, which is always there, but restless and fidgety feet is a very, very important entry point of sulfur. You all must remember. I was just differentiating that anxiety and weeping part. That's why it just crossed my mind. That's why I've basically telling you something about sulfur, phosphorus. There was one remedy, of course, where I have used it very, very frequently now in the practice. This symptom is there, and that is Kali iode. Normally, when we think about Kalis, you normally think about that, what do you call, the anger, the outrageous part of Kali, which is more towards the family, more towards the love part, loved ones. But again, this anxiety, or you can say weeping after anxiety, becomes a very, very important symptom of Kali iode. Kali iode definitely has a lot of other symptoms, but this is very important. Next remedy is graphitis. Now, whenever you are prescribing graphitis, of course, whenever you are prescribing graphitis, we think about the constipation and a lot of other symptoms of graphitis. But graphitis, if you want to differentiate, there are some symptoms which are very, very common and which are very, very important for graphitis. Anybody can tell me something about graphitis? Yes, which is so important and you have to understand that symptom in graphitis. Anybody? There are doctors online. See, in graphitis, as it is said that in calcarea carp, the patient is fair, fat, flabby. In graphitis, remember, the patient has a tendency to skin affection and constipation, and they are fat also, and chilly also, costive. But the difference of graphitis and calcarea is graphitis comes with the delayed menstrual history, and the patient takes cold very easily. This is again a very, very important symptom of graphitis, tendency to obesity. Whenever you have tendency to obesity, do think about graphitis because graphitis covers lot many of cases. In fact, graphitis, if you see clinically, would be very useful in cases of hypothyroidism also. If you basically have any questions, you can start asking questions because there are doctors are online now. I was just thinking, I was just telling you something about my experience of that weeping after anxiety, and that's why I told something about graphitis, kali iode, phosphorus, carcinogen. Basically, I think you all know very well. One symptom of graphitis that you must always remember that hot drinks disagree. This patient of graphitis will always come and say that whenever I am drinking hot water or hot tea or green tea, I am not happy. I feel something is missing, or it causes pain in the abdomen. There's some vomiting. There is a lot of other things. The symptom is hot drinks disagree. So if you tell the patient to drink maybe soup, hot soup or tea or hot water for any other complaint, and if he says that is not better with this, it does not suit him, you must think about graphitis. These are such an important entry points of this remedy that you should know something about graphitis. And one symptom of graphitis that you should remember that menses are too late with constipation. Menses are too late with constipation. Constipation again is a very, very important symptom of graphitis. Whenever you are ready with some questions, you can always ask me. Otherwise, I'll keep on speaking on Mater Medica. One remedy, this is important for that symptom which I thought was weeping after anxiety. And it's a very, very interesting and a rare, not a rare remedy, but infrequently used in that condition, and that is spongia tosta. Do think about spongia tosta, infrequently used remedy, because anxiety, weeping after anxiety is again a very, very important symptom of spongia tosta. And if you see cases of thyroid, you can see symptoms, you can see the cases of goiter, and the patient has this symptom, then you must think about spongia tosta. That's why in spongia it is written swelling and induration of glands and goiter. Swelling with induration of glands and goiter, that's again a very, very important of spongia. And in spongia, remember that anxiety, weeping after anxiety. One symptom of spongia which normally most of the doctor will not get a look or they don't look for that symptom, that is worst after sleep or the patient sleeps into aggravation. Of course, lachesis is definitely there, but every time the patient is not lachesis. So remember, in spongia, the patient is worst after sleep or the patient sleeps into aggravation. I had a very interesting case, of convulsions and epilepsy, when the patient used to say that whenever I get up in the morning, I have a lot of heavy head and I feel as if I'll get an attack of convulsions. Every morning, that same symptom, though I prescribed the patient lachesis, it failed, and then spongia tosta cured the complaints. Sometimes what happens that we have always been thinking that spongia is of course a good remedy for cough, and we don't look beyond that. If we try to look beyond what is written and what is very specific in that remedy, you will be able to have a wide variety of application of that same remedy. So welcome, Dr. Porkar. So do remember spongia when the patient says that he sleeps into aggravation, sleeps into aggravation, and of course the thyroid symptom will continue. So we have a very interesting, yeah. So there was a question last time. We had a case where the patient had infarction of a 63-year-old patient, and Dr. Meera was there. So she is writing on that YouTube. I think Instagram person will not be able to see that. And she writes, Arnika worked like magic, and the patient is out of the ICU. So thank you much. Okay. Should I keep him on SL now? MRI shows occlusion in right internal carotid artery. Yeah, you keep the patient on Phytum for at least a week, then review the case again, and then you can repeat arnica. But in the meantime, if you have arnica LM potency, remember, if you have arnica LM potency, I think you can get it at your place. Start arnica immediately from 0/7, at least once a day, and you will get a very fantastic result. Maybe the occlusion of the ICA, the internal carotid artery, would also be cured with arnica. And thank you for sharing the experience of the last YouTube. And it is very important that whenever I prescribe something for the case, and if you get results, do share your results so that we all learn from what question answer we are sharing, because that's why we are here to understand and to prescribe the remedy and to see the results. So thank you, Meera. Good. And start LM potency arnica. So welcome, Dr. Gill, Dr. Ishwa CMQ. Yeah, I was talking something about spongia tosta with that symptom, that weeping after anxiety. So in fact, if you have these type of cases, whether on YouTube or on Instagram, in case where I have told you some remedy in a disease and it has got good results, do share the experience so that we all can learn. And the purpose of this question answer session for my is taken care of, because here we are here to discuss cases and see the result live and very transparent. That is very important. Yes, Dr. Monsuri Vashi, welcome. So it's something about spongia. So I told you something sleeps into aggravation, and I told you something about induration of the gland. One symptom of the spongia which everybody should remember apart from the symptoms of thyroid is angina pectoris. Spongia, when prescribed, is a very, very interesting remedy. When angina pectoris, there is a lot of constricting pain, anxiety, and sweating aggravation after midnight. This symptom is very, very important, and with palpitation and violent with the pain and gasping respiration. And the patient suddenly awakes after midnight with suffocation, lot of anxiety. That is an important symptom of spongia tosta. So look beyond the cough symptom of spongia tosta, and you'll have a different idea about remedy which you have never learnt about. So palpitation, which is very violent, it wakens the patient suddenly after midnight. There's a lot of suffocation, there's great anxiety, and especially it is indicated for valvular insufficiency. So this symptom of spongia related to heart, related to the thyroid gland, and sleeps into aggravation is a very, very important symptom of spongia tosta. I hope everybody got some view about spongia, because if there are no questions, and if there are no questions, I can always be basically trying to tell something about my experience. So one more message from Dr. Weber. Thanks for the support in case of hip pain. It is much better after strontium carbs. So fantastic. Again, one more review of our remedy, which we basically discussed on YouTube. I think on Instagram, you can't see because the doctors here on YouTube are basically giving us the live review of the results on YouTube. So there was a case of hip joint pain, and while discussing the symptoms, we came out with the remedy strontium carb. And according to Dr. Weber, strontium carb, after strontium carb, the patient is much better. So thank you for sharing your experience, Dr. Weber, and really appreciate all the doctors that they are sharing the experiences. So I also get confidence sometimes, that whatever I am telling and whatever symptoms you are giving me for prescription, it is working. It is really a boost to me also, of course, to everybody. Strontium carb, a very very interesting remedy. If you open your mathematic of strontium carb, of course it contains lot many of symptoms of related to bones and all, but strontium carb, it's a very very important remedy for rheumatism. It's a very very important for rheumatism. And if you see in strontium, it is important rheumatic and chronic sprains. Chronic sprain also is a very very interesting symptom of strontium carb. And you will be very surprised that when Rustox has been given, Ruta has been given, Belisper has been given, which is not working, you give strontium carb and it will work very fast. Chronic sprains. And one more symptom of strontium carb, which I recollect a case, we had stenosis of the esophagus. The patient was suffering from Achillea cardia. He could not take anything from the from mouth because there was a lot of spasm, stenosis. Strontium carb helped that case, and the patient basically is now able to eat solid food, not totally cured, but much better. He started gaining weight much better with strontium carb. So that's why I always say, of course, strontium carb has lot of remedy of symptoms in relation to bones, but there are other symptoms also of strontium carb, which when learned properly in a proper way, you will get very good results of strontium carb in relation to this. That's why it is said that strontium carb is a very interesting remedy for arteriosclerosis. Because of that, the patient suffers from high blood pressure with flushing of face. That is the indication of strontium carb. And of course, we can go on and on strontium carb, but these symptoms are very important in relation to strontium carb mathematic. So welcome Dr. Anja Smith. Good afternoon, Dr. Neha. So this is strontium carb. Again, if you see that in strontium carb, it is a very interesting remedy when the patient says that the pain is so much. The pain is so much that because of the pain, it makes the patient faint, or the patient feels very sick all over. So much so pain. So don't always think about chamomilla or coffee or opium. They are there, but strontium carb is also there. So whenever the pain is so much, which makes the patient faint, or which makes the patient sick all over, do think about strontium carb. These are very very interesting remedies. You have to look beyond what you have seen. Okay, so this is something about strontium carb. Welcome, Dr. Shabbir. So as we go further, of course, in strontium carb, if I have some time, I'll tell you something. A strontium carb is a very interesting remedy for supraorbital neuralgia. The pain also increases and decreases slowly, like sternum metallicum. So these basically are those type of remedies where if you basically are, if you open your eyes and read Mathematica, you'll be able to give very good result in cases and in remedies which you never thought of. So that's why I was discussing that symptom of weeping after anxiety. I hope everybody got some clue about that rubric or remedy which I prescribed: graphitis, kali iode, phosphorus, and spongia tosta. Spongia, of course, I think most of the symptom of spongia come in relation to goiter or gland, but still we discuss something. And last remedy for that symptom that you should remember is carcinosin. Now I know carcinosin is a remedy, it's a beautiful remedy, and I think everybody knows carcinosin very well. But to add something about carcinosin, of course, it is a very, very interesting remedy, intercurrent remedy for history of cancerous complaint or hereditary history of cancer, and the patient likes drawing, the patient is likes painting, the patient likes very artistic, very social, loves animal, very sympathetic. These type of personalities are carcinosin. And it is said that whenever you are prescribing carcinosin for maybe cancer of mammary glands, the discharges are offensive. That is carcinosin, very very close to Echinacea or Asteria rubens or Carbonimalis. But this is also important, and it's a very important remedy for indigestion when there's a lot of gas in the abdomen. That is carcinosin. Very very interesting remedy. I hope everybody I know everybody must be knowing something about carcinogens. So welcome Dr. Rangari, Dr. Ganorkar. Yes, so if you have some questions, you can always ask. Otherwise, I'll be getting on and on with the Mater Medica, and the time will be over, and then uh, will not be able to answer your questions. As you go further, of course, if we do not discuss one remedy with anxiety or weeping after anxiety, it will not complete that topic, and the remedy is sulfur. You know lots about sulfur. You have read about sulfur, and I think I don't need to tell you that it is burning and all that. Everybody know, but there are some symptoms where sulfur is very important. You remember the patient comes and tells you that whenever I am suffering from any disease, first there is burning in that part, and then the disease starts. The patient says, if I have psoriasis, I have burning in one spot, and after burning in 2-3 days, the psoriasis starts, the spot starts. Or the patient says there's a lot of burning in the whole body, and then the itching starts. So this is the entry point of sulfur. Wherever the disease is starting, there is burning, and then the symptom starts. This again a very, very important symptom of sulfur. Next, sulfur patient, of course, delusion and the rags seems beautiful is always important. But a sulfur patient is busy all the time. Remember, a sulfur patient is busy all the time, and that symptom is a very, very important symptom of sulfur. The patient is busy all the time. You can say with work, without work, that's up to the patient, but always busy. That is sulfur. And so this symptom. And third is there is burning, there is a circulation problem, there is throbbing, because it causes irregular disturbance of the circulation, and that's why it causes the local burning. This is something very important in relation to sulfur. Welcome Dr. Litish. Next, in sulfur you have to remember one thing, that is ascending effects. Ascending effects, not descending, ascending effects. And a sulfur patient would come and tell you that everything is centered in the epigastrium. Everything the patient feels as everything is centered in the epigastrium. Like for instance, I told you about Kalikarp. In Kalikarp, everything is centered in relation to the eyes. The burning is there, the migraine is there, complaints in relation to eyes with yawning. In the same way, sulfur is everything is centered in the epigastrium. And in sulfur, it is said that sulfur basically is a remedy for coal miners affection. Coal miners affection, and that is again an important symptom of sulfur. In coal mines, people working, you get cases from coal mines, they have asthma, they have itching, they have indigestion, they have sense of smell which is sometimes very bad or sometimes very low. They can't appreciate taste. People working in mines, they have headache problem. So miners, chronic minus problem is also a very, very important symptom of sulfur, and complaints that are continuously relapsing. When the complaints are relapsing, sulfur works very beautifully. So by this we finish that weeping, anxiety after. These 4-5 remedies are very, very important, and this symptom, if you get in which defines the patient's whole personality, that is basically you at the time to prescribe sulfur. And of course, stoop-shouldered patient does not want to be walked, does not want to be washed, is sulfur very untidy, the body has very bad odor. This is all symptoms of sulfur, but today we are not discussing the whole mathematics of sulfur, but important entry points of sulfur. Any other symptom of sulfur you find that you have seen in your practice and that has given you good results, very rare symptom, but still by seeing that symptom you have prescribed sulfur. Anybody can share their experience. See, every time I only share my experience, sometimes you also can help me share your experience. Any symptom you found in sulfur, very rare, but you entered that case through that symptom and you got good results. Anybody? Everybody has some experience of lots of remedies. It's always important to share your experience. Sulfur. That's why I've asked a very, very common remedy, sulfur. Any experience of sharing, of having some symptoms of sulfur, which basically very rare, but you got that symptom? Anybody? Can we have some symptoms of sulfur? No. Sulfur patient craves raw onion. Okay, very nice. Uh, Very nice. I have not seen if this is see, we are asking this symptom because sometimes what happens, you always make your own mathematica, what is important, what you have seen in your life. So Dr. Meera has shared her experience that sulfur patient likes or craves raw ice. Very nice, very nice. Because if you see in mathematica, if you see Dr. Meera in repertory, desires raw onion, desires raw onion is not present, because raw onion desires, there are few remedies which I remember is, I think, allium cepa, sabardilla and thuja. Sulfur is not there. So it's a very interesting symptom, Dr. Meera, and everybody keep a note of sulfur which craves raw onions, because if you get some results by this symptom, you can definitely add to your own mathematica so that it helps you in future. Dr. Weber says, gave my mother in pneumonia sulfur with great success. Okay. See, sulfur basically works on all the planes of the body, but we're asking some symptom which you have found very useful in sulfur in prescribing that led you to the entry point of sulfur. Can you share on which symptom you prescribe sulfur, Dr. Weber, to your mother? So that we can learn also, some mathematica from you also. Dr. Komal Chandwani, welcome. So by the time Dr. Weber shares the experience, we'll take something in relation to sulfur. I remember, the remedies, the constitution which craves or desires raw onion. I have some constitution basically which have aversion to raw onions. Very, very important remedy. Very, very interesting remedy. The first remedy I'll tell you, that is phosphorus. So whenever there is onion in the plate, a phosphorus patient will not eat, because a phosphorus has aversion to raw onions. Aversion to raw onions. Please write down on my abdomen feeling. Okay. So phosphorus basically has aversion to onion. In fact, sabardella, thuja, which have desires for raw onions, also has aversion to raw onions. So aversion to onions, you have to think remedies like phosphorus, nitric acid, medoranum, and lycopodium. These remedies are very, very important in case of aversion to onions. There is one symptom which is very, very interesting in that is aggravation by eating raw onions. In that, Dr. Meera, you have sulfur, lycopodium, pulsatilla, and thuja. Aggravation from eating raw onions. The patient comes and tells you, by this time my asthma was very good, but when I ate raw onions, the asthma started. So don't think that because of onion, your remedy was antidoted and you repeat the remedy. No. Sulfur as a classical symptom, thuja, sulfur, pulsatilla, lycopodium, that whenever this patient eats raw onion, it aggravates the complaints. Welcome, Dr. Fatima. Maximum sulfur patient has history of property dealing business. Oh my, very nice, Dr. Meera. Very nice. So Dr. Meera says that sulfur patient basically has problems with history of property dealing and in business. Okay, we have noted that. So something in relation to sulfur I told you. And one thing I remember about onions, whenever you have patients who are telling you that the perspiration smells like raw onion, in that also, the remedy is lycopodium and calcarea carb. So this is so common, and see, this is so interesting, or you can say that the patient has expectoration. The patient in cough has expectoration, which tastes like onion. The remedy is against sulfur, asafoetida, and arsenic album. But I have found very good results when the expectoration tastes like onion. I will normally give asafoetida. So these are a very interesting symptom of phosphorus. In fact, of sulfur. In fact, when the odor of the urine is like onion, then the remedy is phosphorus. Can we go further, or I'll discuss something about of sulfur? In sulfur, the odors in sulfur, the smell, odor is like onion, and the remedy is mancinella. So in regarding to onions, we have smell like onions, or urine odor like onions, or expectoration like onions, or perspiration odor of onions. In generalities, I told you desires onion, aggravation by onion, and aversion to onions. So everything related to enzymes we have discussed, and it was a very interesting talk, because these are very very common symptoms the patient comes and tells you. Okay, any other question? Dr. Rahul Chaube, you are very late. We are at the end of the session. So in relation to onions, I think we are shifting from the anxiety, the weeping part, to the onion part now. Now, whenever the patient comes and tells you that whenever I eat onions, I have disordered stomach. Don't think that your remedy has been antidoted and you have to change the remedy. No. Whenever the patient says कि जब भी मैं प्याज खाता हूँ ना, मेरा पेट खराब हो जाता है, मेरे को लैट्रिन लग जाती है, मेरे को पेट में तकलीफ होती है. So disordered by eating onions, think about again Lycopodium, pulsatilla, and thuja. And you'll be surprised to know there are remedies like Lycopodium, thuja, pulsatilla, sabadilla, allium supercum so many times when we talk about onions. And that's why if it is an interesting and a very important PQRS symptom of onions, do take that symptom for prescriptions. In fact, during COVID times, there was a case where the patient says, I have eructations like onions. Eructations like onions, and I prescribe the patient magnesium mure, and that gives me good results. Dr. Weber says, do you have experience with cancer of vocal cord? Yeah, I have few cases of cancer of vocal cord. I have few cases of the paralysis of vocal cord. The results are good. The patient is better, but still on treatment, still not cured, I would say. So I think it is already 3:30. Half an hour goes very fast. Sometimes, I feel that you should increase that time period, but I don't know. Sometimes the questions rate of the speed of asking questions should slow down, so I cannot stop and stop or wait for the questions. Okay, so thank you all. Thank you for joining me. Today was an odd time, Monday, but because I missed on Saturday, I did on Monday. This time again, next YouTube will be on Saturday at 3 o'clock. So meet you then. Until then, goodbye and thank you for your time.